Hi there, my name is Sabina Reddy. I'm an occupational therapist with Milestone Therapy. We are a pediatric company, which means we serve children from birth to 21 years of age. Today I'm going to talk about what is occupational therapy. I'm going to turn my camera around presentation slides. So what is occupational therapy? OT is the therapeutic use of self-care, work, and play activities to increase independent function, enhance development, and prevent disability. An important point is that OT is client-centered. What does client-centered mean? As its name implies, client-centered therapy places significant focus on the client being the child and the parent. This means that goals are developed jointly with the parent and are focused on the needs of the child, not the therapist. What is the occupation of a child, you might ask? Well, since the work of children is play, it is through this that OTs assist children in learning the skills necessary for living. What areas do OTs address? Well, we look at developmental delays, attention and focus, writing problems, self-dressing and grooming, strengthening, gross and fine motor concerns, oral motor weakness, sensory processing difficulties, coordination, and visual perceptual difficulties. Why is poor attention a problem? Well, attention problems challenge a child to stay focused on a game or other play activity. A child who cannot focus will have difficulty learning. What is meant by strengthening? Well, we are making the muscles stronger or more effective to engage in activities of daily living. Why is strengthening important? Well, muscle tone and joint stability in the trunk, shoulders, wrists, and hands are important for hand skill development. What are fine motor skills? Well, these involve the small muscles of the body, like the hands, that enable such functions as writing, cutting, coloring, grasping small objects, and fastening clothing like buttons and zippers. Fine motor skills involve visual perception, eye-hand coordination, strength, and dexterity. In contrast, gross motor skills, usually worked on by physical therapists, are those used to move your arms, legs, and trunk in a functional manner. They involve the large muscles of the body that enable such functions as walking, jumping, kicking, sitting, lifting, and throwing a ball. What are oral motor skills? Well, these refer to the movements of the muscles in the mouth, jaw, tongue, lips, and cheeks. The strength, coordination, and control of these oral structures are the foundation for feeding-related tasks, such as sucking, biting, crunching, licking, and chewing. How do you develop oral motor skills? Well, you could try granola, apples, carrots, pretzels, nut butters, licorice, or fruit leather. Chewing gum can also help children develop oral motor skills and help them focus. Even plain drinking straws are a fantastic tool for helping your child develop oral motor skills. So what is sensory processing? Well, this refers to the way the nervous system receives messages from the senses and turns them into responses. For someone with a sensory processing disorder, sensory information goes into the brain, but it does not get organized into an appropriate response. So what is SI that OTs are always talking about? Well, the sensory systems include sight, hearing, taste, touch, and smell, but also two more called vestibular or movement and proprioception or body awareness. Since learning is the function of the brain, impaired sensory integration can lead to learning deficits. An example of this might be a child who holds their hands over their ears to protect from sounds, or someone who reacts emotionally or aggressively to touch. And the OT might place the child on a sensory diet. What is a sensory diet? This requires the right combination of sensory input to keep an optimal level of arousal at all times. An example could include aerobics, weightlifting, jumping on a trampoline, or playing on playground equipment. So what are visual processing skills? Well, this involves the ability to organize and interpret the information that is seen and give it meaning. These skills are what our brain uses to make sense of what we see in the world around us. When a child is behind in the development of visual processing skills, learning can take longer, requiring more cognitive effort that slows down the learning process. So how do I know if my child will benefit from therapy or even needs OT? Well, the OT would first of all do an assessment. A typical evaluation they could use is called the Peabody Developmental Motor Scales. This is an early childhood motor development program that provides an assessment, training, or remediation of gross and fine motor skills. It's composed of 6 subtests that measure interrelated motor abilities that develop early in life. It is designed to assess the motor skills of children from birth through 5 years of age. And it was normed or tested on over 2,000 children residing in 46 states. Now, the top part of the chart looks at gross motor skills, and we're only going to look at the 2 bottom parts of the chart, which looks at fine motor skills. It starts at 0 months and goes all the way to 72 months.